The fallout from the pandemic has begun, even before some care homes say they're not yet sure they're over the worst of the outbreak. This care home in County Durham is part of a group of 4 and had over 100 residents. 6 died from coronavirus. But its owner-operator says the high number of deaths across the country in care homes has left the industry fighting for its own life.
Are you finding that relatives are losing faith in sending their loved ones to care homes?
The level of fear is quite high, so we're not getting the inquiries, we're just getting people voting with their feet. And so what that means is, in the long term, 6 months hence from now, care homes will be under serious pressure as they start to empty out.
Giving evidence at the Health and Social Care Select Committee, Care England, the largest representative body for social care in the UK, gave this damning assessment of the government's treatment of care homes.
We should have been focusing on care homes from the start of this pandemic. What we saw at the start was a focus on the NHS, and that meant that care homes often had their medical support from the NHS withdrawn. We also had the disruption of our supply chains on PPE. There were cases, I think, of people who either didn't have a COVID-19 status or were symptomatic who were discharged into care homes.
Even the government's own ministers are now appearing to question the handling of the crisis and the reliance on science to shape government policy.
If the science was wrong, advice at the time was wrong, I'm not surprised if people would then think we made a wrong decision. But you have to take judgments based on what you have.
The government says it's provided nearly £4 billion to local authorities to deal with coronavirus, including in care homes.
Formally and in the law, responsibility for care homes is for local councils. I think this actually raises a question not just for the crisis, but for the longer term. When I am held accountable at this dispatch box for the actions of local authorities, I can give support, but we do not have the direct levers.
That doesn't mean much to the care homes reliant on additional funding.
Adequate funding, proper funding needs to be set aside. The funding issue needs to be resolved permanently going forwards. And then it needs to be assured and ring-fenced so that the right amount of money gets through to the coalface.
The question now, to what extent did protecting the NHS mean overwhelming some care homes? Lisa Holland, Sky News.